So I think the first distinction is we split them into age-related and not age-related. So age-related cataracts are the natural process that happens with age without any external interference from diseases such as diabetes or from trauma to the eye or from congenital or problems acquired in childhood. So for senile cataracts related to older age, the opacity may not be uniform all through the cataract. And we can think of the lens that I described before as a peanut M&M. It has a hard center called the nucleus. It has a softer shell called the cortex. So the hard center is obviously the peanut, the softer shell is the chocolatey part, and then the capsule is the colored M&M cover. So if you think about it that way, a nuclear cataract is where that very central part hardens and becomes very milky, and that's generally quite a uniform process. It gives you a uniform fogging of the vision, of reduced quality, etc. The cortex can opacify on its own, and the way that it opacifies is in little radial spokes. So if you imagine the cataracts here, the cortical spokes will be like this, and those cataracts are the most likely to cause those glare and night vision problems because the light rays hit the spoke and they become dispersed, causing glare rather than focused on the retina, which is what they should be doing. And finally, a posterior subcapsular cataract is where the opacity happens right behind the capsule, so behind that colored M&M shell, and it happens usually just along that surface. Again, it can progress quite quickly. So if somebody's optometrist tell them they've got a posterior subcapsular cataract, it may not be symptomatic when they see the optometrist, but 3 months later, it may have crossed over into that line of sight and then be suddenly very symptomatic. And people usually come in quite worried, like it was fine 3 months ago and I'm really scared, but it's just because it's been building and it's just about crossing that boundary where it's right in their line of sight. So those are those cataracts. Then there are patients who have diseases that lead them to develop cataracts earlier rather than later. And this includes diabetes. So diabetes is a big one. On average, diabetics develop symptomatic cataract 10 years prior than their non-diabetic counterparts. They're more likely to have that posterior subcapsular cataract as well. If you've got other eye conditions, such as if you've had lots of eye surgery or you've had inflammation or uveitis in the eye, you're more likely to get an earlier cataract. And if you've had any form of trauma, either blunt or sharp to the eye, that trauma itself can disrupt the metabolism inside the lens and cause opacification. There's another category, which is congenital or acquired cataracts, but I think that's beyond the scope of today's talk.